Underactive thyroid, also known as hypothyroidism, is a condition in which the thyroid gland does not produce enough thyroid hormones. These hormones, primarily thyroxine T4 and triiodothyronine T3, are essential for regulating metabolism, energy production, and the function of many organs in the body. When the thyroid is underactive, it can lead to a slowing of bodily functions, resulting in a range of symptoms and health issues. Causes of underactive thyroid hypothyroidism. Hypothyroidism can be caused by a variety of factors, including Hashimoto's thyroiditis. This is the most common cause of hypothyroidism. It is an autoimmune condition where the body's immune system attacks and damages the thyroid gland, leading to reduced hormone production. Iodine deficiency. Iodine is necessary for the production of thyroid hormones. In regions where iodine is lacking in the diet, hypothyroidism can develop. Thyroid surgery, removal of part or all of the thyroid gland, often due to thyroid cancer or other thyroid conditions, can lead to insufficient hormone production. Radiation therapy, treatment for cancer involving the neck or head, can damage the thyroid, resulting in hypothyroidism. Medications. Certain medications, such as lithium used to treat bipolar disorder or amiodarone used for heart arrhythmias, can interfere with thyroid function. Pituitary gland problems. The pituitary gland produces thyroid-stimulating hormone TSH, which regulates the thyroid. If the pituitary gland malfunctions due to a tumor or injury, it can lead to an underactive thyroid. Congenital hypothyroidism. Some babies are born with an underactive thyroid due to a genetic condition or developmental issues with the thyroid gland. Aging. The risk of developing hypothyroidism increases with age, particularly after 60. Symptoms of underactive thyroid. The symptoms of hypothyroidism can vary in severity and develop slowly, sometimes over many years. Common symptoms include fatigue, feeling unusually tired, even after a full night's sleep. Weight gain, unexplained weight gain or difficulty losing weight, despite normal eating habits. Cold sensitivity, feeling cold even in warm environments, or having cold hands and feet. Constipation, slower digestion leading to constipation. Dry skin and hair. Skin may become dry, pale, and flaky, and hair can become dry, brittle, and thin. Depression or low mood, feeling down, sad, or depressed, possibly due to hormone imbalances affecting brain chemistry. Memory problems, difficulty concentrating or experiencing brain fog. Muscle weakness and cramps, particularly in the upper arms and thighs. Joint pain, achy joints or stiffness, sometimes similar to arthritis. Hoarseness or voice changes, due to thickening of the vocal cords. Slowed heart rate, a slower than normal heart rate. Bradycardia may occur in some people. Puffy face, swelling around the eyes and face. Thinning eyebrows, especially the outer third of the eyebrows. Elevated cholesterol, high levels of cholesterol or other fats in the blood. Diagnosis of underactive thyroid. To diagnose hypothyroidism, the doctor will typically order a blood test that measures thyroid-stimulating hormone TSH. The level of TSH is the most commonly used test to diagnose hypothyroidism. In an underactive thyroid, the TSH level is usually elevated because the pituitary gland is trying to stimulate the thyroid to produce more hormones. Free T4 and free T3. These are the two primary thyroid hormones. In hypothyroidism, these levels will typically be low. Antithyroid antibodies. If Hashimoto's thyroiditis is suspected an autoimmune cause, the doctor may also check for specific antibodies like anti-thyroid peroxidase antibodies that indicate an autoimmune attack on the thyroid. Ultrasound. In some cases, an ultrasound of the thyroid may be performed if there is concern about a goiter or nodules on the thyroid. Treatment of underactive thyroid hypothyroidism is usually treated with hormone replacement therapy to bring thyroid hormone levels back to normal. The goal of treatment is to restore normal metabolic function and alleviate symptoms. Levothyroxine. The most common treatment is synthetic thyroid hormone in the form of levothyroxine, which is taken orally. It is identical to the thyroxine before produced by the thyroid. Once in the body, levothyroxine is converted into the active form V3 that cells can use. Levothyroxine is usually started at a low dose and gradually increased based on blood test results and symptoms. Ligodeironine T3 in some cases, ligodeironine, which contains the active form of thyroid hormone T3 may be prescribed, particularly if symptoms persist despite levothyroxine therapy. Combination therapy. In some cases, a combination of levothyroxine and ligodeironine may be prescribed, though this is less common. Monitoring. After starting treatment, patients need to have regular blood tests to ensure that thyroid hormone levels are within the optimal range. Once the correct dose is determined, periodic testing is usually done to ensure the levels stay stable. Lifestyle and dietary considerations. Although medication is the primary treatment for hypothyroidism, certain lifestyle and dietary modifications can help manage symptoms. Healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can support overall health and help manage symptoms of hypothyroidism. Iodine. While iodine deficiency is rare in many parts of the world due to iodized salt, it's important to ensure adequate iodine intake for thyroid health. However, excess iodine can also interfere with thyroid function, so supplementation should only be done under medical supervision. Exercise. Regular physical activity can help combat fatigue, support weight management, and improve mood. Avoid soy and high-fiber foods. Soy and very high-fiber foods can interfere with the absorption of thyroid medications, so they should be consumed in moderation or at separate times from taking medication. Complications of underactive thyroid. If left untreated or poorly managed, hypothyroidism can lead to serious complications, such as heart problems. Hypothyroidism can increase the risk of heart disease, high cholesterol, and heart failure. Infertility. Hormonal imbalances can interfere with ovulation and cause infertility. Goiter. An enlarged thyroid gland due to excessive TSH production, though this is less common with modern treatment. Mental health issues. Persistent depression, anxiety, and cognitive problems may occur if hypothyroidism is not well managed. Myxedema coma. The rare, life-threatening condition characterized by severe hypothyroidism, cold intolerance, low blood pressure, and unconsciousness, often triggered by stress or illness. Outlook for people with underactive thyroid. With proper treatment and regular monitoring, people with hypothyroidism can lead healthy, normal lives. The key to successful management is taking the prescribed thyroid hormone replacement medication consistently and having periodic blood tests to adjust the dosage as needed.